Hi, this is Degé Coutee with Patient Advocacy Network at CannabisSavesLives.org, and this is your weekly edition of the Compassion Flower Report, news and information about medical cannabis around the world. We're going to cover a few headlines tonight. The news is a little scarce, and a lot of that has to do with the fact that we're moving forward, going toward an election. And right now, a lot of reporters are just scrambling, trying to find content, anything they can basically talk about to kind of fill in between now and election night. So one interesting election story, and then we've got some good news that came out of Congress just within the last 24 hours or so. A few other headlines just to touch upon. But I know at the end of this, end of each edition, I let you know where you can contribute and help Patient Advocacy Network. And I just thought this particular episode, I would early on in the show let you know how vital and important it is to have your support for what we do, what we continue to do, and really more about what we need to do. So please, I want you to consider contributing. Patient Advocacy Network. We are a 501c3 organization. Donations are always tax deductible. If you have any questions, I'm very easy to get a hold of. You see where all of our contact information, social media information is. My phone number is there and available along with email. So get a hold of me if you have any questions about what we do and how we use your contribution dollars. 100% goes to education, advocacy, and direct action. So get involved. Thank you so much. Like I said, it's election time and we're seeing a lot of kind of some repeat information here. However, the exciting information that came out of Washington, D.C. yesterday, this story in particular is from the National Law Review, and it says expanded medical marijuana research bill approved by Congress. This refers to H.R. 5634. It says recently U.S. Representative Matt Gaetz introduced the Medical Cannabis Research Act, which would facilitate and encourage federally approved clinical trials testing the medicinal effects of chemicals found in the marijuana plant. The bill is notable because if passed, it would bypass the United States Department of Justice as it relates to marijuana research licenses and put the task in the hands of Congress. Currently, the House Judiciary Committee, which is responsible for the drug enforcement efforts of the federal government, approved the measure. If the bill passes, it would provide an opening for more medical marijuana research, which has been virtually non-existent at the federal level over the last 5 decades. Notably, the act increases the number of federally approved manufacturers of research-grade marijuana from 1 to 3 and sets strict criteria for those manufacturers to obtain and renew their registrations. Currently, only the University of Mississippi is permitted to grow research-grade marijuana. 2 years ago, the U.S. Drug Enforcement Administration announced that it would allow more cannabis growers to cultivate marijuana for research purposes by opening up the licensing process. However, no additional licenses have been issued despite many completed applications by competent and eager applicants. When U.S. Attorney Jeff Sessions was appointed to the Department of Justice, he did not help the cause, according to Sessions. There will only be some benefits to medical marijuana, but it's perfectly appropriate to study it, but refused to allow any additional cultivation applications to be dealt with by the DOJ. Without the ability to grow cannabis legally, researchers are unable to properly study and the safety, efficacy, and medical uses of marijuana. The story goes on, but that beginning part of it is most important. So again, what we see in this story is that initially the DEA agreed to open up this licensing process so that there can be research. And with Jeff Sessions there at the helm of the Department of Justice, nothing has moved forward. So now we have a bill that has moved forward that puts this in the hands of Congress instead of the Department of Justice. I don't think something like the medical research and research doing trials, clinical trials, is something that should be in the hands of the Department of Justice anyway. So we'll see how this proceeds. Right now, as you heard me say, the University of Mississippi is the only permitted grow facility for research grade marijuana. That's for the NIDA program. That is, I want to think it started off as 13 people in this research project. This started in the 80s. There were several AIDS patients and then some patients that had glaucoma and some unusual blood disorders. And they were getting experimental marijuana from this NIDA program that was growing it at the University of Mississippi. They get a tin. It's just like a metal tin about that big around, about that tall. And it has 300 marijuana joints in it. It has like the prescription label, says it's from the federal government, the whole 9 yards. You can Google this. If you want to look at Google marijuana package tin, you'll see images of this. However, this cannabis is the stems, the leaves. I've seen seeds in it. I had the pleasure of meeting and spending some time with Alfie Musica, who is one of the recipients of this program, and she has shown me her tin that she's freshly gotten from the pharmacist, and I've gotten to see what the quality and grade is of that marijuana. And we definitely need other entities growing it for research purposes if we're going to get some good data. So I find that that's a good move there to begin to look at it. I just find it interesting that we have so much anecdotal evidence, and there's a lot of evidence from overseas, but we don't have any here in the United States. And this is one of the things that keeps cannabis trapped inside the Controlled Substances Act. Next story real quick that we'll talk about. Compromise reached in Utah Medical Cannabis Initiative Proposition 2. I've been covering this throughout the end of the summer and into the beginning here of the final stretch of the election season, because there's been a lot of contention around this Proposition 2 in Utah. And basically the opponents of this initiative think that basically it's not strict enough. And so there's been a lot of controversy. This I find this very interesting. This is from the Standard Journal, Salt Lake City. A compromise concerning the legalized distribution of medical cannabis in Utah, known as Proposition 2, has been reached. Elder Jack N. Gerald of the 70 of the Church of Jesus Christ of Latter-day Saints joined state leaders, medical experts, and other religious clergy on Thursday at Utah Capitol Hill to announce the settlement. Many people have worked tirelessly to craft a community solution to alleviate human pain and suffering, and we're thrilled to be part of that conversation, Gerard said in a press release by the church. Gerard noted that the medical cannabis issue had generated strong emotions and caused a heated debate. The proposed solution announced today as a byproduct of good faith and willingness to work together by opponents and proponents of Proposition 2, he said. Opponents have expressed concern that Proposition 2 fails to create a proper balance for patients seeking medical treatment while also protecting society and especially youth from harm. Michelle McAmber of Drug Safe Utah and CEO of the Utah Medical Association also spoke. The association has been part of the coalition against Proposition 2. We believe the compromise has addressed most of the medical community's concerns that are in the ballot proposition right now that physicians saw as non-medical and harmful to patients or recreational that would harm all Utahns, particularly Utah's children, adolescents, and vulnerable populations, she said. During the statement, Utah Governor Gary R. Herbert reported physicians and pharmacists would receive training in dispensing the medical cannabis through specialized pharmacies or local health departments. Stringent controls will be in place for cultivation to prevent recreational use of the product. Greater respect of local zoning laws will be provided and clarifications will be made for law enforcement, Herbert said. McAmber encouraged the process to move forward to craft the best solution for Utah that would bring true medical marijuana into the state in a very controlled way that is not controlled by the marijuana industry and is not recreational. Utahns will have the chance to vote on the subject in November. It's expected that opponents of medical marijuana will prove less vocal against it than they have in the past, the press release said. It goes on a little bit more, but this is what I find really interesting. And this is basically what this story is saying. The Proposition 2 has enough signatures to be on the ballot. It will be voted on in November. So far, the polling for the initiative would indicate that it is over 60%, so it's doing very well. And now there is what appears to be something going on in the legislature to craft rules that are a little more stringent than what the proposition has. Now, I'm not an expert on Utah law, but I know that here in California, the legislature can't pass a law that puts restrictions on a voter initiative. So if this voter initiative is, I guess rather what they think is a little loose, they don't think it's strict enough. Technically, like I said again, depending on what their state laws are, they should not be able to just wave a magic legislative wand and amend a voter initiative that hasn't even gone through the election process yet. So again, I'm something else to be curious about and watch and follow. But again, Utah passing something that already usurps a voter initiative that hasn't even gone to the voters yet. So this is a really short, there's a lot in the story, but this is a PR Newswire story. So most of this story is a press release and a promotion for some of the clients that they're working with. But the story in the very beginning of it says, data projects the global medical cannabis market to eclipse $33 billion by 2022. So again, this is something that we began reporting on maybe 3 episodes ago, talking about these stories that I guess there's been enough data produced by states that have both medical and adult recreational cannabis that we're looking at numbers, and different consulting firms and data analysis firms are doing projections about where the market is going on local, on a national as well as a global level. So this says that the data projects the global medical cannabis market to eclipse $33 billion by 2022. And just this, I think, says it all, because like I said, most of this press release goes into discussing the portfolio of clients of theirs. Are really, I think, trying to promote their product, of course. According to a report published by Orastep Consulting, the global medical cannabis market was valued at $12.67 billion in 2016 and will reach $33.41 billion by 2022, while growing at a CAGR of 17.53% during the forecast period. So they're saying that's a 17% growth rate between 2016 and 2022, and that the want and the need for medical cannabis is just going to continue to grow. Just a few headlines that don't really require any explanation, because I think they say exactly what they need to say. Just a little trip around the United States here, what's going on. Arkansas medical marijuana program well behind other states. It's taking them a very long time to get licenses out. Tampa's largest medical marijuana dispensary opens. In Illinois, medical marijuana use up 83% in the state. PTSD, most common condition being treated there in Illinois. Medical marijuana clinic is opening Monday in Louisiana, and Oklahoma gets 600 medical marijuana dispensary applications. So that's what went on this week in medical marijuana. All of these stories and more are available for you at our Twitter page at Pan for Compassion. That link will be there for you below. Please sign up for email updates at cannabissaveslives.org for news, action alerts, and more. I thank you for watching. Please donate. PAN is a 501c3 organization. You can visit us at cannabissaveslives.org and click the donate button. Become a monthly sponsor in any amount that is right for you. Please like, subscribe, and share this video. And until next week, I'm Degé Coutee, and this has been the Compassion Flower Report.